report. Troubling vaccine data pushing COVID boosters next month. COVID-19 vaccine boosters are likely to be deployed to the general public soon. This is because new data showed how fast current vaccines decline against the Delta variant. The FDA will become busy once vaccine makers start applying for revised EUA of their vaccines. The data was from 3 studies published by the U.S. Centers for Disease Control and Prevention on Wednesday. Here, the protection offered by vaccines dropped in the midsummer months, when the Delta started its dominance. The vaccine still provided protection against hospitalization, despite the variant's impact. The Washington Post reported that the administration of booster shots among fully vaccinated individuals with Pfizer and Moderna will start in the week of September 20. This was announced by top health officials after recognizing the need for boosters. So, Israel's early administration of boosters to vulnerable people appears a good call. Examining numerous cohorts through the end of July and early August, 3 points are now very clear, said CDC Director Rochelle Walensky. Walensky explained that vaccine-induced protection against COVID-19 decreases over time, but protection against severe disease, hospitalization, and death remains relatively high. Unfortunately, the Delta variant decreases the effectiveness of vaccines in general. Thus, some experts are now agreeing with boosters to mitigate the negative influence of this variant on vaccines. In the studies, vaccine effectiveness was measured by comparing the rates of infection or hospitalization among the vaccinated to the rates among the unvaccinated. About 20% of new cases and 15% of hospitalizations due to COVID were among vaccinated people. The figures clearly showed a decline in protection. According to Politico, a recent British study showed more evidence of decreasing vaccine protection over time. The study highlighted the Pfizer-BioNTech and AstraZeneca-Oxford vaccines. The former could prevent up to 85% of infections 2 weeks after the second dose. It gave better protection than the latter. After 90 days, however, the mRNA vaccine's effectiveness started to drop to 75%. Researchers cautioned the public from drawing conclusions just yet. While Pfizer's vaccine seems weaker than AstraZeneca's in the study, it doesn't mean the results are absolute. Further research is required to solidify the study findings. So what is the takeaway? Get vaccinated, because if Delta variant can infect the vaccinated, how much more do those who aren't vaccinated? Its mutations are so sinister that many experts are considering boosters beyond the vulnerable population groups. Visit our channel for the latest trends. Please subscribe to our channel and hit the bell icon for fresh content daily. Thanks for watching!